Today's topic of the video is the consent form. It is the informed consent is the process in which a healthcare provider educates a patient about the risks, benefits, and alternatives of given procedure or interventions. The patient must be competent to make a voluntary decision about whether to undergo the procedure or intervention. Informed consent is both an ethical and legal obligation of medical practitioners in the US and originates from the patient's right to direct what happens to their body. Implicit in providing informed consent is an assessment of the patient, understanding, attending an actual recommendation, and documentation of the process. The Joint Commission requires documentation of all the elements of informed consent in a form, progress notes, or elsewhere in the record. The following are the required elements for the documentation of the informed consent discussion. First is the nature of the procedure. Second, the risk and benefits and the procedure. Third is reasonable alternatives. Fourth is risk and benefits of alternatives. 5. Assessment of the patient's understanding of element 1 through 4. It is the obligation of the provider to make it clear that the patient is participating in the decision making process and avoid making the patients feel forced to agree with the provider. The provider must recommendation and provided their reasoning for said communication. Adequacy of informed consent. The required standard for informed consent is determined by the state. The three acceptable legal approaches to adequate informed consent. First is subjective standard. What would this patient need to know and understand to make an informed decision? Second is reasonable patient standard. What would the average patient need to know to be an informed participant in the decision? Third is reasonable physician standard. What would typical physicians say about this procedure? Many states use the reasonable patient standard because it focuses on what a typical patient would need to know to understand the decision at hand. However, it is a sole obligation of the provider to determine which approach is appropriate for the given situation. Exemption of informed consent. Several exceptions to the requirement of informed consent include the patient is incapacitated, second, life-threatening emergencies with inadequate time to obtain consent, and third is voluntary waiver consent. If the patient's ability to make decision is questioned or unclear, an evaluation by psychiatrist to determine competency may be requested. A situation may arise in which a patient cannot make decision independently but has not designated a decision maker. In this instance, the hierarchy of decision makers, which is determined by the each state's laws, must be sought to determine by the next legal surrogate decision maker. If this is unsuccessful, a legal guardian may need to appointed by the court. Children and informed consent. Children, typically under 17 years, cannot provide informed consent. As such, parents must permit treatments or interventions in disease. It not termed informed consent, but informed permission. An exception to this rule is legally emancipated child who may provide informed consent for himself. Some, but not all, example of emancipated minor include minor who are 1. Under 18 and married, second, serving in the military, third is able to prove financial independence or mothers of children married or not. Legislation regarding minors and informed consent is state based as well. It is important to understand the state laws. Informed consent for blood transfusion. Informed consent is essential to patient autonomy Informed consent requires a thorough understanding of transfusion and the ability to convey this information to a patient in a way that they can understand it. However, obtaining consent often is deficiencies in the explanation where benefits may not be entirely true and risk related are omitted. It has been shown that involving experts from transfusion units in obtaining informed consent for transfusion results in the patients having better understanding the risks and benefits. However, always involving an expert may not be the most efficient way to obtain consent. Although new graduate physicians have a knowledge deficit when it comes to transfusion medicine. However, physicians that had previous transfusion medicine education displayed more understanding than those who did not, as most physicians will need to obtain informed consent for a transfusion at one point in their career. It could be argued that physicians should have enough education in regards to transfusion medicine. The type of transfusion and their indications are first is red blood cell. Acute blood loss of greater than 1500 ml or 30% of blood volume, or acute blood loss causing hematodynamic instability. Symptomatic anemia, hypotension, dyspnea at rest, tachycardia that is not responsive to fluid when hemoglobin is less than 10 gram per dl. Hemoglobin of less than 7 is in asymptomatic patient, hematodynamically stable patients in intensive care, and patients undergoing cardiovascular surgery. Hemoglobin of less than 8 gram in patients with cardiovascular disease or postoperatively. Second is fresh frozen plasma. Can be used for apheresis in thrombotic, thrombopenic purpura or hemolytic urinary syndrome. Acute disseminated intravascular coagulopathy with active bleeding. Emergent reversal of warfarin in major or intracranial hemorrhage prophylactically in an emergent surgical procedure. Third is platelet. Platelet count of 10,000 per ml in stable patient without active bleeding. Less than 20,000 ml per ml stable patient without active bleeding with fever or are they undergoing an innovation procedure. Ciprocate, hemorrhage after cardiac surgery. Next is surgical bleeding. Next is massive transfusion. Fifth is massive transfusion protocol. Adverse effect of transfusion. First is acute hemolytic reaction. The recipient's antibodies attacks transfused red blood cells, whether caused by a reaction to a ABO blood group or antibodies produced from various transfusions. Acute hemolytic transfusion occur within 24 hours of transfusion. Symptoms including fever, nausea, vomiting. Second is allergic reaction. It can present ranging from mild to life-threatening allergic reaction. Patients with mild symptoms may present with hives. More severe reactions will present with hypotension. Next is febrile non-hemolytic reaction. A febrile non-hemolytic reaction is an increase in temperature of at least 1 degree Celsius during or shortly period of after transfusion. Next is transfusion associated circulatory overload. Transfusion associated circulatory overload is caused by the rapid infusion of blood products which overwhelm the recipient's circulatory system. Patients may present with tachycardia, hypertension, dyspnea, and cough. Delayed hemolytic reaction. Delayed hemolytic reaction occurs more than 24 hours after a transfusion is completed. Transfusion associated graft versus host disease is caused by donor lymphocytes in blood procedure, proliferating and mounting an attack against the recipient's tissue and organs. Transfusion related immunomodulation. Transfusion related immunomodulation is the immunosuppressive effect of transfused blood products leading to prospective infection, tumor recurrence, and nosocomial infection in critical ill patients. Thank you.